Hi guys, I'm Dr. Julian Machado and I'm a chiropractor here at LC Chiropractic. Now the purpose of this video today is because it's twofold really. I want to get you guys more familiar with our system, and our system is really what makes us unique and different from other chiropractic offices. So for example, when you give us a call to make your first appointment, we want to ask you a couple questions. That question is going to ask you really what brought you in today. Now the purpose of that information is because the doctor's always going to go over that. The reason why we want to know that information is because it's going to help us dictate which paperwork we're going to give you when you do come in. Now after you come in, our staff will be expecting you and he will greet you at the door, and then you're going to meet Chloe, which is our new patient advocate. Now the cool thing about Chloe's job is her job is to basically make you as comfortable as possible. So with our system, right, some people are unfamiliar with it. So she's going to be there to walk you through the whole system on your first day, your second day, and if God willing, the whole week. So any questions you may have, you have her direct contact information, you'll be able to contact her directly. After that, we're gonna give you a tour of our office. And why are we gonna give you a tour of our office is because, again, you guessed it, we're unique and different from other chiropractic offices and we have different machinery here. So for example, our transformation station is our traction devices. Now, just like braces for your teeth, right? If you have crooked teeth, the only thing in this world that'll fix them is braces. So the only thing that's gonna realign your spine is these devices that we have here. And we've been trained how to use those devices. So once you get a tour of our office, you get a better idea of what it is we do here and why we do it. Then when you go into the office, you're gonna fill out paperwork. And that's gonna help the doctor better diagnose your case, right? The more information, the better, okay? After you're done with your paperwork, the doctor will come in and you will do your pre-consult and your consultation. Now your consultation is gonna be a way for your doctor to one-on-one get as much information as possible so he can help figure out how he can help you best. After your consultation, we go over and do a physical exam. After your physical exam, the doctor wants to, if need be, take x-rays. Now the reason why we would take x-rays would be if we find any subluxations, any postural distortions, blocking the energy from your spinal cord to certain organs in your body, okay? It's a better way to find out what's going on with your body. Again, you wanna know all the factors. Now, after your full spine set of x-rays, it's gonna take the doctor a certain amount of time to analyze these x-rays. So we don't go and adjust the patient the first day, we adjust the patient the following day. Just like if you were to go to a dentist, you wouldn't want him to start drilling for a cavity without finding out where the cavity is and exactly how big the cavity is, right? Same thing with us. We want to find out all the factors before we write out a treatment plan, before we start to treat you. And finally, we have an ROF, which we call the report of findings. Now here's where the doctor sits with you and hopefully your significant other and explains everything that's going on with your health at that time through your x-rays. After that, your doctor would start the healing process by giving you a specific spinal adjustment. After your specific spinal adjustment, your doctor will take you for a set of stress x-rays. The cool thing about a stress x-ray is imagine if I was a personal trainer, right? And you said, I wanna have a six-pack, I wanna have six-pack abs by next summer. Perfectly fine and perfectly understandable why you'd want six-pack abs. But let's say you go on a treadmill and you can only go for a minute. Those six-pack abs are a little further away than we expected, right? Same thing with a stress x-ray. We're gonna lay you on an orthopedic block that's gonna improve your posture. Now, if your spine is not ready to move in the direction we want it to move, at the speed we want it to move, we will know from that stress x-ray. And that way we can give you a better idea of how long it'll take to correct your condition. After your stress x-ray, most likely, depending on your case, because everyone's different, we would go into the gym or the rehab center where Brooke will take you through your home rehab exercises that the doctor has laid out for her. So by this point, they've already laid out any exercise that you want to do for the first 2 or 3 days, and this is going to reduce inflammation and get you feeling better. And that's your day one, and that's what you expect on your first day. Now, the reason why we want to emphasize that is because we do not want to adjust patients on the first day unless they have a specific condition where the doctor makes a decision to adjust them on that day, but that's not common practice. And the reason why it's not common practice is because we want to make sure that we know all the factors before we start to treat your body.